Hi everyone, and welcome to episode 4 of my Vision Therapy Talks. My name is Dr. Katherine Boas, and all of us here at Boas Vision Associates hope you and your families are staying safe and healthy. Today I'm going to talk about eye movement skills, or what we refer to as oculomotor skills. Normal eye movements are an essential part of good vision and are critical from everything from reading to sports. There are 6 muscles that surround and attach to each of our eyes. These muscles must work together in a sophisticated manner to accurately control our eye movements. Eye movements are actually the fastest and most frequent movements made by the human body. There are 3 basic types of eye movements: fixations, pursuits, and saccades. Fixation is the most basic of the eye movements and at least the foundation for the rest of them. A fixation occurs when you hold your eyes steady on a target for a period of time. The inability to fixate would cause images to appear blurry and confusing. A pursuit occurs when your eyes follow a moving object, such as watching a car pass by. Pursuit eye movements must be accurate in order for us to make spatial judgments about the speed and position of a moving target. This is extremely important in driving and sports. A saccade occurs when our eyes jump from one target to another. These are sudden and quick changes in fixation, and examples include when a child looks from their desk to the board in the front of the room, when an adult looks from their laptop to the presenter in the front of the boardroom, or when a driver looks from a street sign to their speedometer. Accurate saccades are an essential part of reading. Our eyes saccade as we read from left to right across a straight line, and when we reach the end of the line, our eyes must saccade back to the next line. If we don't have healthy saccadic eye movements, we might have poor reading comprehension and lose our place when reading quite often. Oculomotor dysfunction, or OMD, occurs when an individual has a deficiency in one or more of these eye movement skills. This is a very common vision disorder and affects people of all ages. This is a condition that cannot be outgrown. It can often go undetected because testing is usually not included in a pediatrician's eye tests, school screenings, or basic eye exams. All of our doctors here at Boas Vision Associates are highly trained to detect, diagnose, and manage the treatment of an oculomotor dysfunction. One of the tests that we administer during an evaluation here at Boas Vision Associates is called the Developmental Eye Movement Test, or DEM. We ask the patient to call out the numbers listed here as quickly as they can, going across left to right, the first line, and then jumping to the next line and doing the same thing, calling out the numbers going left to right. We time the patient and we collect information if they made any errors, and then we compare this information to an age-based normative data set. Another test we administer is called the Visograph. During this test, the patient wears these goggles here. There are infrared sensors within the goggles that will measure the eye movements made by a patient as they read a grade-appropriate passage silently to themselves. The program will collect all of the data and analyze the data, comparing it to a national grade level normative data set and goals. If we detect an oculomotor dysfunction during our evaluation, we will develop an individualized vision therapy program to treat the OMD. Vision therapy is highly effective in treating eye movement disorders, and it produces lasting results. So if you, your child, or anyone you know skips words when they read, has to reread the same line over and over, uses their finger to follow along while reading, or they lose their place, has difficulty completing assignments, or has a short attention span when reading, then they should have a functional vision evaluation by one of our doctors here at Boas Vision Associates or by a behavioral or functional optometrist. We are here to help you. I hope you have enjoyed this episode. Thank you for watching. Please call our office if you have any questions or concerns, and of course, stay healthy.